I chose to research the treatment options for the mentally ill. My research hypothesis is the mentally ill receive better care in an institutional setting over the general public. My research questions were: what is mental illness? How has the treatment of mentally ill individuals improved over the years? What treatment options are available? What is the individual's success rate after treatment? The purpose of my research was to determine if mentally ill individuals receive better care from the general public or in an institutional setting. The technology and equipment that I used were research statistics, case studies, and personal life experiences. The main findings of my research were, on average, roughly 26% of Americans 18 years and up, or 2 out of 10 individuals, will experience some kind of mental illness. This is in addition to 2 out of 50 people that will live with a constant mental illness. These statistics show that nearly 60 million individuals suffer from some form of mental illness. These individuals are not the only ones affected by their diagnosis, but their loved ones, friends, and community also suffer. Most individuals diagnosed with a mental illness will require some form of treatment. The yearly individuals may only need a medication to assist them with the symptoms and help them overcome their illness. The individuals that live with the illness daily may require extensive treatment, such as individual therapy, group therapy, and perhaps even being institutionalized. The individuals that live with this daily will receive better care inside of an institutional setting rather than in the general public. During the early 1960s and 70s, the mentally ill were often abused and neglected. They did not receive the proper care or treatment during this time frame because there was no funding available. The psychology field had not been fully developed and was just starting to gain recognition from the public and the government. Institutions were mainly used for housing the mentally ill but not treating them. This allowed them to hide from society. High behavioral clients were chained to the walls, which today is considered to be abuse and neglect. Resources, education, and medication wasn't as readily available as they are today. For decades, many chose to ignore the problems that strayed from society's norms and expectations. Society didn't become more accepting until President Kennedy started his movement to create proper, humane institutions and care facilities for these individuals. After President Kennedy's assassination, President Carter continued on with Kennedy's work. Both presidents' efforts allowed each state to create the facilities and the funding to provide more possibilities for the mentally ill. This time span was also when the court system took someone's mental capacity into consideration and became more lenient in their judicial rulings. Judges would include seeking proper medical treatment into the sentencing process. The late 1970s made society aware that the 1960s and early 1970s facility requirements were not being met. There wasn't any legal binding forcing the guidelines set in the late 60s and early 70s. Therefore, each citizen's constitutional rights were not being met. Roughly 25% of the states chose not to meet the state requirements. The 1980s was focused on setting the requirements legally, demanding each state to uphold the constitutional right of every citizen, despite their circumstances or diagnosis. Now that each state has required to provide adequate treatment for mentally ill individuals, the economy began to plummet, leading the federal government to withdraw most of the funding. This dropped the financial burden on the individual states. Many states did not have the budget to pick up the federal slack and started shutting down most of the facilities. With the facilities closing, the mentally ill had nowhere to turn but to public treatment. When states began closing the institutions, the patients were left to receive support and care from the community. Community treatment options were limited as the communities were not fully equipped or structurally set up to meet everyone's needs. The family members in healthcare facilities were not prepared to handle their responsibility and caused many to suffer. The public had to figure out how they could assist the mentally ill with getting proper treatment. This included creating a plan on how to teach them how to integrate back into society. Specialty houses were created that provided them with structured support, individualized treatment, and taught them basic life skills of how to survive once they left the house. They were taught how to live with family members, how to manage stress, how to be independent, and possibly start a family of their own one day. The United States wasn't the only country that struggled in providing for the mentally ill. India was also well known for how they treated their mentally ill civilians after the institutions closed down during the 1980s. They also created specialty houses, but instead of attempting to teach and care for the individuals, they decided to keep them chained to the walls. News footage was released of one of these houses being burnt to the ground with the residents still inside. Once the nations were made aware of living conditions, the United Nations began movements ensuring the safety and security of the mentally ill worldwide. They set up stipends of land or money for family members that chose to take in their mentally ill family members. Since the 1980s, the public created more facilities to assist those with mental illness. Daily programs were designed to allow the individuals a place to go during the day. This allowed family members a break from the constant care and someone to care for their loved ones while they worked. These day programs provided structured support for the clients to learn new tasks such as making crafts and cooking. Halfway houses are places that an individual can go if they are not mentally capable to live independently with family. They learn how to care for themselves and not completely rely on others for assistance. Community therapy focuses on reinstating the individuals back into society. The individual meets with a certified counselor on a scheduled basis to discuss their interactions and what they are struggling with. They are taught how to manage daily stress and what reactions are appropriate based on society's expectations. Community rehabilitation programs are the state's preferred treatment. It is more than 60% cheaper since it only provides 8 hours of care versus around-the-clock care. Patients are perceived as being more independent because they can make their own life choices. These programs also decrease the possibility of the client being readmitted into inpatient mental health facility as they aren't as much of a burden to their family. Studies show that medical staff are not fond of individuals diagnosed with a mental illness. These studies also present that most medical staff have little to any education of mental illness disorders. During the study, medical staff were produced with more mental illness education and what these individuals go through on a daily basis. The study results also showed that once staff had more education and training, they were more empathetic to people diagnosed with a mental illness. This lack of empathy is generally from the belief that people will get what they deserve, that it is fate or karma. Individuals are diagnosed with a mental illness to pay for something they themselves or one of their family members have done. It was believed through the 18th and mid-19th century that when a man became ill, it was the woman's job to care for them. This wasn't any rule or expectation if a woman became ill. If the man in the family could not care for the woman, it fell back to the woman's family. In most situations, her parents themselves were elderly and sick. They did not have the means. Many worried that today's society was reverting to the institutional mindset. Institutions are again becoming recognized as the best way to care for the mentally ill. Institutional care is provided in both a mental facility and prison facility. In the mental health facility, individuals receive around-the-clock care. There are always trained staff on shift to provide guidance and care. The staff can make sure that clients are safe from harm, whether it be from others or themselves. The daily structure allows the clients to learn a daily routine during the day. Clients are taught living skills and are assisted on working on already learned tasks. This helps them improve their learned skills and get into a routine. Clients are grouped together based on their mental capabilities. Those that can handle detailed work activities learn and encourage each other. Psychologists tend to frown upon institutional settings. They believe institutions provide too much structure with staff always around. They do not learn full independence. The facility guarantees clients make their scheduled appointments, eat on time, leave schedule, complete hygiene procedures, and take their medications. I have witnessed this firsthand. I have worked 2.5 years at one of these few facilities that remain in the state of Iowa. It was my job as a residential treatment worker to keep them on task and provide a safe and structured environment. Before a worker can do their duties, after they are hired, they must undergo a 3-week training. This is when workers learn how the facility wants the clients to be taught, acceptable conduct and procedures, and receive education about the different mental illnesses the clients at the facility may be diagnosed with. There was a psychological team that creates individual plans for each client. These individual plans explain to the worker what the client's diagnoses are, how to respond to their behaviors, and how to provide care to meet their individual needs. My facility did not believe in using physical restraints and rarely used medication to calm or render the client unconscious. We were taught to block their behavior and redirect them per their individualized plan. Some plans suggested redirecting them back to the task they had been doing, or if they had a preferred task or sensory comfort item, to attempt that. In most cases, using these techniques did help. If we couldn't de-escalate them, we were to redirect them to a more secluded area. This took them away from stimulation and allowed them to calm down, but they were never left alone. The worker remained within eyesight to ensure they meant themselves or another individual no harm. It is understandable why psychologists believe facilities such as the ones that I worked at does not promote the independence we think we promote. It is up to the workers to ensure that the client gets up on time and do their daily routines. We encourage them to make as many decisions as possible along the way. If they struggle to decide, we simply narrow down the items and then they will learn how to make decisions upon that. The goal is that eventually clients will be able to make the decisions on their own based on their interactions with staff. Yes, we did make sure that they kept their appointments and arrived on time. This taught them that they must be responsible and manage their time correctly. We start by telling them what time they needed to leave. Most of the clients could tell time and would begin reminding staff as time grew near. We accompanied them out in public. That way, if they interacted with a situation that they were unsure of how to react, we could provide guidance and feedback on their behavior. Some clients were nonverbal and relied on staff to communicate for them. Some had talking devices that pre-recorded messages and phrases such as "my name is," "I'm hungry," "I need to use the bathroom," or "I'm ready to go to bed," and other phrases like this. This allowed the client to communicate what they needed and decrease their frustration because staff couldn't understand what their wants and needs were. Simple procedures such as the ones listed aid each client to become more successful in reintegrating back into society. Beside the assumption that inpatient mental health care facilities provide too much structure, another disadvantage is that they are difficult for people to get admitted to. Each facility has some criteria an applicant must meet in order to gain admittance. In most cases, the individual has already tried self-harm or harm to another. People are not able to just walk in and ask to be admitted at the beginning of a mental crisis. They must be court-ordered or committed by multiple loved ones. Prison facilities are used for the individuals diagnosed with a mental disability and was mentally competent enough to stand trial. These individuals possess enough intelligence to know the difference between right and wrong and pose a threat to society. Prison facilities are preferred because they are more secured and there is a smaller escape risk compared to a mental facility. In a prison facility, mentally ill inmates are given medication to decrease their symptoms and behavior. Prison facilities are required by the state to provide a minimal treatment guideline for each inmate. There is not a standard or guideline explaining to staff what their expected duties are. With the high cost of mental treatment and no set guidelines, most facilities choose not to use most of the facility's budget for mental health. With the inmate population constantly increasing, facilities need all the funding they can spare to keep sufficient trained staff on hand. This means that prison facilities choose to provide the minimum treatment and focus more on ensuring the safety and structure of the whole facility and society. The only trained staff is the medical staff. Prison guard training focuses on how to decrease the threat in a situation. They are not educated how to properly handle the mindset and behaviors of the mentally ill. If an inmate displays repetitive behavior, they are prescribed an additional medication to control the behavior. If the behaviors are severe enough, the inmate will be placed in solitary confinement until they no longer pose a threat. With the lack in training and smaller staff to inmate ratio, the risks of self-injurious behavior are higher in a prison setting rather than with a mental health facility. Inmates choose self-injurious behavior and attempt suicide if staff can't intervene on time. Mentally ill inmates do not receive the same individualized care as in mental facilities. They feel they are not being supported and tend to fall into despair. Rehabilitation programs are quite different in a prison setting. They focus on changing and reprogramming the individual's thought process. Counselors work with inmates to assist and learn from their past mistakes. Some of these mistakes might be multiple offense of theft. With struggling to hold down a job, the mentally ill turn to stealing, whether it be food or expensive items to pawn for the money. Some go to using illegal drugs because they are cheaper than prescriptions and help decrease their symptoms. Many inmates claim that they can develop a sense of self-worth. During incarceration, they are expected to complete tasks such as making their bed and cleaning the unit. Some inmates consider their good behavior, can get into a work release program, and work with outside companies under guard supervision. Inmates are taught life skills that they can use once they are out into society. After the inmates complete their sentence and are released, many do not possess the ability to pay for community treatment or housing. Prison facilities have trained staff that can assist inmates with filling out proper paperwork for assistance and resources. They also can help them apply for programs that assist with paying for housing and gas if they have a vehicle. After the individual discharges from either the mental facility or correctional facility, they rely on the community resources to help them continue their progress. Many go to a halfway house where they can receive similar structure and support as they do in the institution. This is a step down from the institutional setting. Individuals are granted more freedom to make their own choices and test what they have learned, but they also have mentors to assist them when they hit a snag. Halfway houses give them the taste to live in a societal setting. Mentors do not intervene unless they are asked or believe the individual is putting themselves or others at risk. In conclusion, mental health facilities provide the best structure and educational support for individuals with mental illness. Clients are provided with an individual care plan that is developed based on their own individual needs. They receive more one-on-one attention and are taught life skills by trained staff. This differs from a prison facility as the guards are not as trained on how to properly handle their behaviors. These behaviors are addressed with additional medication instead of trying to teach them alternative ways to express their feelings. Both facilities rely on community resources and facilities to assist these individuals upon discharge. The summary of possible conclusions presented that I yielded was, I discovered that mentally ill individuals receive the best care from a mental facility. Mental facilities have the appropriate trained staff for the variety of diagnosis and have more funding options. Correctional facilities are the second best option despite the lack of trained staff because they still have funding options to treat the individual. Community-based treatment is the least preferred due to lack of funding. For the individuals that have never been inside a mental or correctional facility, they tend to struggle the most. For the individuals that go from a treatment facility to a community treatment, they have a better chance of striving due to the knowledge and skills they obtained inside the facility. Despite community treatment being the least preferred, it would still be better than no treatment at all. Thank you.